Hey everybody, welcome to Mind Blown. Today we'll look at signs that you're about to have a mental breakdown. Make sure to keep watching until the end, as we will provide you with information about a mental breakdown. What is a nervous breakdown? Everybody experiences stress and anxiety when they feel under pressure, though usually at manageable levels. When stress and feelings of worry or anxiety are there all the time and build up to a level that impacts a person's daily life, they may be described as having a nervous breakdown. A nervous breakdown, also known as a mental health crisis or mental breakdown, describes a period of intense mental distress. A person having a nervous breakdown is temporarily not able to function in their everyday life. Nervous breakdown is not a medical term or a mental health diagnosis, since it does not describe a specific condition. It's a term that is sometimes used conversationally to describe someone who is not coping with stress, worry, or anxiety, or overwhelmed by mental health issues. Nowadays, doctors have better ways of diagnosing, describing, and treating intense mental distress, which can help avoid stigma in mental health. There is no one cause of a nervous breakdown. Anything that leads to excessive stress can trigger it. Some things that might trigger a nervous breakdown include a sudden tragedy, a major life change, constant pressure at work, sometimes referred to as burnout, anxiety, depression, poor sleep, abuse, financial problems. Experiencing some stress is a normal part of life. When the feelings become too overwhelming, they can contribute to a mental breakdown. While these breakdowns can be scary and debilitating, there are things that you can do. Recognizing the signs, taking preventative action, and getting treatment can help. Signs you're on the verge of a mental breakdown. 1. Panic attacks. Too much stress might even lead to a panic attack, which may feel like something more severe. Panic attacks trigger your sympathetic nervous system. This leads to the fight or flight response that you experience when faced with danger. Without treatment, frequent and prolonged panic attacks can be severely disabling. The person may choose to avoid a wide range of situations, such as leaving their home or being alone, for fear of experiencing an attack. A panic attack can occur suddenly and without warning. Its symptoms may come on gradually and peak after about 10 minutes. They may include one or more of the following: heightened vigilance for danger and physical symptoms, anxious and irrational thinking, a strong feeling of dread, danger, or foreboding, fear of going mad, losing control or dying, feeling lightheaded and dizzy, tingling and chills, particularly in the arms and hands, trembling or shaking, sweating, hot flushes, accelerated heart rate, a feeling of constriction in the chest, breathing difficulties, including shortness of breath, nausea or abdominal distress, tense muscles, dry mouth, feelings of unreality and detachment from the environment. In some cases, you may develop an overwhelming fear of experiencing another panic attack. This may be a sign that you've created a panic disorder. Panic attacks aren't life-threatening, but their symptoms can be similar to those of other life-threatening health conditions, such as heart attack. If you experience symptoms of a panic attack, seek medical attention right away. It's important to rule out the possibility that you have a heart attack. 2. Insomnia. Excessive stress may cause insomnia for some people, making it difficult to fall asleep and stay asleep. When you can't sleep, your brain and body can't recover from stress, which in turn can lead to worsening stress and anxiety. A lack of sleep can also affect your physical health as well as your mental performance. Others may respond to stress by oversleeping, which may also lead to psychological and physical problems. Doctors make a clinical diagnosis of insomnia if both of these criteria apply. Sleep difficulties occur at least 3 nights a week for a minimum of 3 months. Sleep difficulties create significant distress or functional problems in a person's life. The causes of your insomnia will depend on the type of sleeplessness you experience. Short-term insomnia or acute insomnia may be caused by several things, including stress, an upsetting or traumatic event, changes to your sleep habits like sleeping in a hotel or new home, physical pain, jet lag, certain medications. Primary insomnia has no known cause. Secondary insomnia occurs with another condition that can include medical conditions that make it harder to sleep, such as arthritis or back pain, psychological issues such as anxiety or depression, substance use, sleep apnea, diabetes. People who experience insomnia usually report at least one of these symptoms: waking too early in the morning, unrefreshing sleep, trouble falling or staying asleep. There are both pharmaceutical and non-pharmaceutical treatments for insomnia. Your doctor can talk to you about what treatments might be appropriate. You may need to try several different medicines before finding the one that's most effective for you. 3. Hallucination. Hallucinations are sensory experiences that appear natural but are created by your mind. They can affect all 5 of your senses. These symptoms may be caused by mental illnesses, the side effects of medications, or physical conditions like epilepsy or alcohol use disorder. Types of hallucinations: visual hallucinations. Visual hallucinations involve seeing things that aren't there. The hallucinations may be of objects, visual patterns, people, or lights. For example, you might know a person who's not in the room, or flashing lights that no one else can see. Olfactory hallucinations. Olfactory hallucinations involve our sense of smell. You might smell an unpleasant odor when waking up in the middle of the night, or feel that your body smells terrible when it doesn't. This type of hallucination can also include scents you find enjoyable, like the smell of flowers. Gustatory hallucinations. Gustatory hallucinations are similar to olfactory hallucinations, but they involve your sense of taste instead of smell. These tastes are often strange or unpleasant. Gustatory hallucinations, often with a metallic taste, are a relatively common symptom for people with epilepsy. Auditory hallucinations. Auditory hallucinations are among the most common type of hallucinations. You might hear someone speaking to you or telling you to do certain things. The voice may be angry, neutral, or warm. Other examples of this hallucination include hearing sounds, like someone walking in the attic, or repeated clicking or tapping noises. Tactile hallucinations. Tactile hallucinations involve the feeling of touch or movement in your body. For example, you might feel that bugs are crawling on your skin, or that your internal organs are moving around. You might also feel the imagined touch of someone's hands on your body. The best thing to do is call your doctor right away if you suspect that your perceptions aren't real. Your doctor will ask about your symptoms and perform a physical exam. Additional tests might include a blood or urine test and perhaps a brain scan. If you know someone who's hallucinating, don't leave them alone. In some severe cases, fear and paranoia triggered by hallucinations can lead to dangerous actions or behaviors. Stay with the person at all times and go with them to the doctor for emotional support. You may also be able to help answer questions about their symptoms and how often they occur. 4. Post-traumatic stress disorder, PTSD. PTSD is a mental health disorder that begins after a traumatic event. That event may involve a real or perceived threat of injury or death. This can include a natural disaster like an earthquake or tornado, military combat, physical or sexual assault or abuse, an accident. People with PTSD feel a heightened sense of danger. Their natural fight or flight response is altered, causing them to feel stressed or fearful even when they're safe. PTSD used to be called shell shock or battle fatigue because it often affects war veterans. According to the National Center for PTSD, it's estimated that about 15% of Vietnam War veterans and 12% of Gulf War veterans have PTSD. But PTSD can happen to anyone at any age. It occurs as a response to chemical and neuronal changes in the brain after exposure to threatening events. Having PTSD doesn't mean you're flawed or weak. PTSD can disrupt your normal activities and your ability to function. Words, sounds, or situations that remind you of trauma can trigger your symptoms. Symptoms of PTSD fall into 4 groups. Intrusion, flashbacks where you feel like you relive the event over and over. Vivid, unpleasant memories of the event. Frequent nightmares about the event. Intense mental or physical distress when you think about the event. Avoidance, As the name implies, avoidance means avoiding people, places, or situations that remind you of the traumatic event. Arousal and reactivity. Trouble concentrating, startling easily, and having an exaggerated response when you're startled. A constant feeling of being on edge, irritability, bouts of anger. Cognition and mood. Negative thoughts about yourself, distorted feelings of guilt, worry, or blame. Trouble remembering important parts of the event. Reduced interest in activities you once loved. If you're diagnosed with PTSD, your healthcare provider will likely prescribe therapy, medication, or a combination of the two treatments. 5. Extreme mood swings. It's normal to have days where you feel sad or days when you're overjoyed. As long as your mood changes don't interfere with your life to an extreme degree, they're generally considered to be healthy. On the other hand, you may have a medical condition if you regularly switch from extremely happy to highly depressed. If you have severe and frequent shifts in mood, you should tell your doctor about them. They can discuss the possible reasons for why you're experiencing them. In many cases, shifts in mood are a symptom of a more severe health issue. They can occur due to mental health conditions, hormonal changes, or substance use problems, among other things. It's common to occasionally experience a mood change or go through a short period of feeling joyful or blue. But if your behavior is unpredictable for several days or longer, it may be a sign of something more serious. You may feel grumpy one minute and happy the next. You may also have emotions that can cause damage to your life. For example, you may be so excited that you find yourself unable to control urges to spend money, confront people, or engage in other uncontrollable or risky behaviors. Feel like you want to harm yourself or end your life. Be unable to visit friends, get enough sleep, go to work, or even get out of bed. Patterns of these types of mood shifts may be symptoms of a more serious health condition. You should schedule an appointment with your doctor to discuss your feelings. They can work with you to determine why you feel this way and what you can do to resolve it. It may be helpful for you to note when you have a shift in mood and what you were doing before it happened. This can help your doctor assess whether you were reacting to a lifestyle change or if it's the result of an underlying issue. How do you manage all these nervous breakdown symptoms? You can break out of the cycle of psychological or behavioral stress by making an appointment with your primary care provider for a complete physical examination to ensure your overall health is not contributing to your symptoms, using either talk therapy or cognitive behavioral therapy, taking prescription medications such as antidepressants or anxiety medication to treat symptoms, practicing alternative treatments such as acupuncture, massage therapy, or yoga. If you're feeling overwhelmed and on the verge of a breakdown, consider these strategies for managing your symptoms. Breathe deeply and count back from 10 when you're feeling anxious or stressed. Cut caffeine and alcohol from your diet. Develop a sleep schedule and routine that will help you sleep well. This could mean taking a warm bath, switching off electronic devices, or reading a book before bed. Tips for self-care. Lifestyle modifications can help you prevent a nervous breakdown. They can also help lessen their severity and frequency. These include: get regular exercise at least 3 times a week, which can be as simple as walking around your neighborhood for 30 minutes, going to a therapist or attending counseling sessions to manage stress, avoiding drugs, alcohol, caffeine, and other substances that create pressure on the body, getting regular sleep and sleeping for at least 6 hours a night, incorporating relaxation techniques like deep breathing into your daily routine, reducing your stress level by pacing yourself, taking mini breaks, better organizing your environment and daily activities, and keeping a daily to-do list. You can make these changes on your own, but it may be more helpful to work with your doctor to create a treatment plan that best meets your healthcare needs. Most people experience periods of stress, anxiety, and hopelessness from time to time, especially after a very stressful events. But if symptoms affect the ability to perform routine tasks, or if the person starts to withdraw socially, it is good to receive professional care. This is especially crucial if the person is considering harming themselves. Medication, counseling, and other treatments can address and resolve what people refer to as a nervous breakdown. If you find this video helpful, be sure to hit the like button and share it with someone who needs to hear this. Subscribe and hit the notification bell to get notified whenever Mind Blown posts a new video. Thank you so much for watching, and see you in the next one.